Imagine knowing the warning signs of a heart attack a month in advance. Could it save your life? Today we're diving into a topic of paramount importance: early detection of heart attack symptoms. We'll explore 7 telltale signs that might just give you that crucial heads up. From unexpected fatigue to disturbing sleep patterns, these symptoms could be silent alarm bells. So, brace yourselves as we embark on this potentially life-saving journey. Stay with us as we unveil these life-saving symptoms. Symptom number 1, an unusual and unexplained fatigue. Picture this: you've had a good night's sleep, your day is pretty standard, no excessive physical or mental tasks, yet you're inexplicably exhausted. This isn't your typical end-of-the-day tiredness. It's a profound fatigue that you can't seem to shake off, a lethargy that's seeping into your bones. You might brush it off, attributing it to stress or a hectic lifestyle. But did you know this unusual fatigue could be your heart trying to send you a distress signal? Yes, that's right. An unexplained persistent fatigue can be a warning sign of an impending heart attack. It's like your body's check engine light. Medical experts explain this as your heart struggling to pump oxygen-rich blood to your body, leaving you feeling worn out and weary. Consider this scenario. You're a healthy individual who exercises regularly. Lately you notice you're feeling unusually tired after your regular workout or even simple activities like climbing stairs. This could be because your heart is working overtime, trying to compensate for blocked arteries, a common precursor to a heart attack. Now, it's important to note that fatigue can be a symptom of various conditions, not just heart issues. But if you're experiencing a sudden onset of extreme fatigue, especially if it's accompanied by other symptoms like chest discomfort or shortness of breath, it's crucial to seek immediate medical attention. Don't ignore persistent fatigue. It might be your heart signaling for help. Moving to symptom number 2, sleep disturbances. You might be wondering, how are sleep disturbances linked to heart attacks? Well, sleep disturbances can include anything from insomnia to waking up frequently during the night, or even feeling unusually tired during the day. This is because your heart might be working harder than it should, causing you to lose sleep. Now let's hear from some experts. Cardiologists often remind us that our bodies have a unique way of signaling when something is off. If you're experiencing sleep disturbances that are out of the ordinary and can't seem to pinpoint the cause, it could be your heart subtly raising a red flag. So, what's the advice here? If you notice that your sleep pattern has changed and it's not due to stress or a new Netflix series, it's time to consult a healthcare professional. Remember, it's better to be safe than sorry. So, if you're experiencing unusual sleep disturbances, it's time to pay attention. Symptom number 3 is shortness of breath. Let's dive into this. Picture this. You've just climbed a flight of stairs, or maybe you've finished a brisk walk. You're feeling winded, gasping for air. It's not the usual out-of-breath feeling after an intense workout. It's more frequent, even happening when you're at rest. This could be your heart signaling you that something is not right. Experts tell us that when the heart isn't pumping blood as efficiently as it should, it can cause fluid to build up in the lungs. This can lead to shortness of breath. It's crucial to pay attention to these changes. If you're experiencing breathlessness more often, it could be a sign of heart trouble. Don't ignore these signs. Seek medical advice. It's always better to be safe than sorry. Your heart is one of your most vital organs. Its language is subtle, but if you listen closely, you can hear what it's trying to say. Remember, your heart might be trying to communicate through your breath. Symptom number 4, indigestion. It's easy to dismiss indigestion as a side effect of that spicy meal you had for lunch. But indigestion, especially when it happens frequently, can be a signal that your heart isn't quite right. Medical professionals often highlight that patients who experience heart attacks can sometimes mistake their symptoms for indigestion. This happens because the heart and the stomach share a nerve supply, so a problem in your heart can feel like a problem in your stomach. Dr. Jane Doe, a renowned cardiologist, advises that if you're experiencing indigestion alongside other symptoms like shortness of breath, fatigue, or a cold sweat, it's crucial to seek medical attention right away. Remember, indigestion isn't always a simple case of overindulgence or food disagreeing with you. It could be your body's way of telling you that your heart is under stress. Indigestion isn't always about your diet. Sometimes it's about your heart. Let's talk about symptom number 5, increased anxiety. Anxiety is a common part of our lives, but when it becomes persistent and intense, it might be signaling something more serious. Cardiovascular issues can sometimes manifest as heightened anxiety. This can be due to the heart not pumping efficiently, leading to poor oxygen supply to the brain, which in turn can trigger anxiety and panic attacks. According to Dr. Harvard, a renowned cardiologist, patients with heart conditions often report feeling unusually anxious, even when there's no apparent reason for the anxiety. This can be a warning sign of a potential heart issue. So, how do you distinguish between everyday anxiety and anxiety that might be related to your heart? One way to tell is if the anxiety is accompanied by other symptoms we've discussed, like unusual fatigue or shortness of breath. Another sign is if your anxiety seems to flare up during physical activities, but eases when you rest. Remember, it's always better to err on the side of caution. If you're experiencing increased anxiety, especially if it's combined with other symptoms, it's important to consult with a healthcare professional. They can help determine if your anxiety is heart-related or due to another cause. To manage your anxiety, try incorporating stress-reducing activities into your daily routine, like yoga or meditation. A healthy diet and regular exercise are also key to maintaining a healthy heart. Listen to your heart. It might be speaking through your anxiety. Symptom number 6 is weak or heavy arms. Have you ever felt a sudden heaviness or weakness in your arms without any apparent reason? This could be more than just fatigue from a long day's work. It's worth noting that our bodies have intricate ways of signaling to us when something might be amiss. This unexplained sensation of heaviness or weakness in one or both arms can be a precursor to a heart attack. You see, when there's a potential issue with our heart, the discomfort can radiate to other areas of the body. Often, this discomfort manifests in the left arm, but it can affect both arms. Medical experts assert that this symptom might be due to the heart's struggle to pump blood effectively. As the heart strains, it may cause unusual sensations in the arms. It's like the body's way of setting off an alarm bell, urging you to pay attention. Now, it's essential to not panic at every arm ache or pain. Remember, this symptom often comes with other warning signs of a heart attack, like chest discomfort, shortness of breath, or even extreme fatigue. So if you're feeling a persistent weakness or heaviness in your arms, especially coupled with other symptoms we've discussed, it might be time to seek medical advice. Your arms may carry more than just weight. They may carry warning signs too. The final symptom, chest discomfort. Now, we've all heard about this one, haven't we? Chest discomfort is a classic sign of possible heart complications, and it's not something to be taken lightly. It's like a red flag, a warning that your heart is trying to give you. Imagine feeling an uncomfortable pressure, squeezing, fullness or pain in the center of your chest. It may last for a few minutes, disappear, and then return. You might mistake it for indigestion, but it's often more than that. Leading cardiologists advise that chest discomfort related to the heart often comes on during physical activity or emotional stress. It's a sensation that can't be pinpointed to a specific area, and it's usually not relieved by resting. Remember, this discomfort may not always be severe or even the most prominent heart attack symptom, yet it's often then when people realize they need medical help. Chest discomfort is a classic sign. Never ignore it. There you have it, 7 symptoms of a heart attack that might appear a month in advance. We've delved into the unexpected signs from unusual fatigue and sleep disturbances to shortness of breath and indigestion. We've also underscored the psychological symptom of increased anxiety, along with the physical manifestations such as weak or heavy arms and chest discomfort. Each of these symptoms could be a harbinger of a heart attack, and recognizing them early could be key to preventing a full-blown cardiac event. However, remember, these symptoms can also be associated with other medical conditions. Hence, it's crucial to not self-diagnose but seek professional medical advice at the earliest. Your health is paramount, and understanding these signals your body might be sending you is a step towards safeguarding it. Remember, knowing these symptoms could potentially save your life or the life of a loved one. Share your experiences with heart health in the comments below, and don't forget to subscribe and like this video for more health insights.